Not recording.
Not to get the specifics of the tape.
Okay, well we're starting. So we're going to start off with buddy taping. Buddy taping is obviously extremely easy. You always tape to the longest buddy. So take your tape, you're going to split it in half. Rip out, 12 inches or so, depending on which finger is hurt. You always tape to its longest buddy. Okay, so here you'd always tape to the ring finger. Ring finger, you can let them decide which one you want to tape it to. Certain athletes like different fingers. Okay, so what you're going to do is you're going to tape right above the joint, and you're going to go around 3 to 4 times. You're going to pull it tighter. Don't just lay the tape on. And then you go below the joint. That's a simple one. Are there any questions on buddy taping? Remember, you can always check to see if it's too tight by doing capillary refill. Got it? Thumb spica. Starting position, like they're going to shake the hands. You start off with a TV tape. So we're going to go here. TV tape, you're just going around the wrist. This does absolutely nothing other than look good for the TV cameras. Okay, so you're going to have a nice broad anchor there. And then again, we're going to split the tape. So having him in this position, the goal is you want to surround this joint. Okay, so you don't want the tape down into the hand, you don't want the tape up into the thumb, you want it to surround the metacarpal phalangeal joint. Okay, so start here, have the tape around the joint, always past the thumb, then go through the thumb, and where everybody has problems, don't pull straight down, pull at an angle. Got it? So you do 2 in each direction. Oops, I'm sure that would have hurt if you were hurt. Okay, now using the other side of your tape, go 2 in the opposite direction. Again, always make sure you pass the thumb, then go around the thumb. When you're done with that, what do? Cover. Anchor everything back down. Okay, so that's gamekeeper's thumb, first metacarpal phalangeal joint. Got it? So again, when you look at it, you have that little space there, pull at an angle. Questions here? Do we need to review TV tape at all? No? Check ring. Again. Yep. So again, this is going to help metacarpal phalangeal joint, first metacarpal. So you're going to take this tape and you're going to get it all the way down into the web of the finger as far as you can. Go right around the thumb, loosely, here, and then go back around. Once you get to this point, so we're at a normal distance, once you mash this together, that is what draws it together. You don't want to pull it and then squeeze it, because then they're not going to have any motion at all. So once you mash that together, then thumb isn't going to go anywhere, finger doesn't let it. Got it? Questions there? Okay, go ahead and stop for a second. Forward to prevent hyperflexion, the rest will be back. Okay? So we start both of them off with a TV tape. On this, you want to have a broad anchor. You don't want a little itty bitty skinny anchor, you want a big old fat anchor. Okay? So we have one anchor there. Turn over, open up the palm. Crease the tape where it inserts into the thumb. So if we want to prevent hyperextension, starting position is a slight flexion. So then you're going to take, and this is where we do our little crisscrosses. And we do 2 X's. And then 2 up and down. Okay, once we've done that, we need to anchor everything back down again. So ideally, this will prevent her wrist from going too far backwards. So if you want to prevent hyperflexion, you do the exact same thing, but you do it on the back side. Do we need to review that? This, where the tape is on the palm, is to prevent hyperextension. If you want to prevent hyperflexion, put the tape on the back. Hyperflexion, hyperextension. So for the elbow, remember when you're taping the elbow, you want the elbow at about 20 degrees of flexion. Okay? We're gonna spray pre-wrap all the way up to the middle of the biceps. Now we're going to use the stretchy tape. Remember, when you're using the stretchy tape, you need to get about half of that on the skin. Don't pull all the stretch out. You want to leave about half of the stretch in the tape, so when she flexes, her biceps will be able to expand. And again, you want nice, broad anchors overlapping your tape by half width. Got it? Once you get to this point, with her at about 20 degrees of flexion, you're going to measure out how much tape you need. Then we're going to go over here to the table and do our X's. 2 X's, 2 up and down, just like the wrist. So once you have this nice, pretty thing, you pull that up. We're going to put that on our tape. And you want the little gap here. You don't want to lay that straight down. And then we anchor everything back down again. Making sure she keeps at 20 degrees of flexion.
What injury is it for?
To prevent elbow hyperextension. So then you take this in the middle and you're going to wrinkle that up. And then ideally, it won't let her go all the way straight. It's already pulled off. Okay? So, Achilles, just relax on this one. So we're going to go pre-wrap. Stretchy tape around the foot. Remember, don't pull all of the stretch out so when they step down, their foot can't expand. And then we're going to do our white tape just like you would for an ankle. Okay, so large anchor, just like the elbow. Measure out how much tape you need. Then we're going to go over to the table. And do our 2 X's. And an extra one just because. And then straight up and down. Fan it right next to each other. Okay? So with this, you want her foot just below 90. You don't want it all the way up here, just below 90. And once you get to this point, you just anchor that back down. And then again, take this and fold it over to make it a little bit stronger. Got it? Okay, a little stretchy tape, nice big anchor. Pull all the spirit out of your toe. Stretchy tape anchor around her big toe. So remember, turf toe is a sprain to this joint. So with this, we want to prevent the toe from going up. So we're going to pull from anchor to anchor, pull the toe down. Quit pulling off. Stay. Okay. At that point, we just anchor everything down again. Good. Arch. I need a new foot. Okay. This is the one everybody has a little bit of a problem with. Okay. So for the arch, again, your normal pre-wrap. Stretchy tape. Do a heel lock. Remember, heel lock. Bottom of the heel, back of the heel, pull it up. Back of the heel, bottom of the heel. Now from this point, we're going to spiral down her foot. And so, see, you pull the tape out and then lay it on. You don't want to pull all of the stretch out. You're leaving some stretch in the tape. Okay? This is in a sense your glorified anchor. It's a very large anchor. Then we're going to take this and you're going to wrap it from the big toe, behind calcaneus, to the little toe. Got it? And then this is where, again, everybody gets confused. Always pull up on the arch. So you pull lateral anchor all the way over to the medial anchor. Overlap by half width and pull up on their arch. So once you go from the bottom to the top, you go yourself right back down. So once you're done there, we anchor it back down. And then you anchor it back down. Questions? Do we need to go over a
Go.
All right, always make sure the ankle is at 90 degrees. Pre-wrap, you want minimal layers of possible, all the way up to just below the gastroc. So your landmarks are going to be base of the gastroc, which ends here, so you're going to start the tape just below that, and then the base of the fifth on the outside of the foot. So with the tape, always start with your tape at an angle on the top and get half width directly on the skin. Overlap the tape by at least half width. So dark, all of that's white, so that's a double width overlap. Anchor on the foot, goes right over the base of the fifth. Okay, so those are your anchors. Stirrups, most ankles are inversion, so we're gonna pull the foot into eversion. So with this, again, have the ankle at 90 degrees, anchor on the calcaneus, and then pull lateral. You're gonna fan at the top, but cross at the same place on the bottom. Three stirrups. Then we're gonna cover everything up, remembering the angles of the tape. So you can see the angle of the tape change from this to this, and that will even change a little bit more in the opposite direction. And you want to cover up all the way down to the base of the calcaneus. Figure 8. Always start with the tape on the big toe side. Go around her foot, go around the lower leg. Pulling up, it prevents excessive plantar flexion. Heel lock. Again, always start with tape on big toe side. Figure 8 angle is here. Heel lock angle is here. I'm going to hit the bottom of the heel, back of the heel, pull it up, back of the heel to the bottom of the heel, pull it up tight. If you do this right, you should have a triangle. You do 2 heel locks. And then go back and lock down the tape. So if you do it right, I don't have a pen. Triangle, triangle, triangle. Good.